certainly having a condition as serious as COVID that's been in the news, that's very frightful, where you don't know what's going to happen, is really going to trigger those things in your mind and your emotional health that maybe you never even contemplated. People just thinking about the anxiety of that, right? And what happens when we start to have anxiety and we don't have good physical health? Our entire mental health starts to deteriorate. The way that we think, we can start to become paranoid. We can start to not know if our mind is telling us the right things. We can start to feel trapped. Once you have COVID, if you are then quarantined in your home, you're isolated. So all these things are recipes for someone's mental health deteriorating, between the isolation, between the unknown, between the fear, between the anxiety, between everything that we've learned. Plus, your body is hurting in strange ways. Particularly with COVID, that I think has been different than other diseases or other conditions like the flu or the cold. We've all probably experienced them from time to time. And so we know what to expect. We know, okay, if I have the flu, these are going to be these symptoms, and these are the things I need to do to resolve them. With COVID, we're constantly learning, and the medical world is learning how it is impacting our body. And so you don't have this memory of a time that you've been through it before that you can rely on. You're having to go with your instincts. And then if you're having symptoms that other people may not have told you that they've had, then you almost start to feel like you are having some mental health crises issues, because your body's responding to the disease much differently. And so I think that really what this has taught us from a mental health perspective is, are people who are not sick, are we teaching people how to be attuned with our emotions? Are we asking ourselves how we're feeling each day? Are we aware of what to do with our feelings? Do we know how to manage our anxiety and our depressive symptoms that, we all have all the feelings, right? And so I think that taking the time to learn how to experience and express and process our emotions when we're healthy will almost provide us those protective factors in case we do get COVID, because then we know how to handle ourselves. I think too often it's not an area that is naturally taught and not considered a strength to know how to deal with our mental health. And so really practicing ways of processing emotions now will really help us when we're in those times when we're in unknown medical conditions.